Welcome to my presentation on promoting oral health in diverse populations. My name is Jenny Schuler. I'm an oral health educator and advocator. I am wanting to thank today Peace House St. Joseph Medical Center. We've been working a little bit with cultural humility there as well, and so we've incorporated some of that. So today I want to talk about the cultural impacts on oral health care, and I want to look at some strategies to meet people where they are, and I like to call it cultural humility. And then we'll identify some ways to have some gentle, curious conversations to help ensure quality care for our clients. And certainly looking at navigation opportunities and strategies that are culturally appropriate for our clients. So I wanted to start by having you think and me think about culture. What does that mean? There's a wide variety of cultures that are represented in our communities. And I like this iceberg concept because what it shows you is the part of the culture that's above the waterline is what we all probably connect with pretty easily, but look how much is below the waterline. And it's interesting as I explore my own culture and other people's cultures, I realize that there is a lot of variety there, and that sometimes what you brought from your culture, you don't want to carry forward, and other things, so they might just leave some things behind. So just some thoughts on culture and to get you thinking. And I wanted to just look a little bit further into culture. And again, they vary greatly, and all of these factors are considerations of our culture. And it impacts our health, so something that we really want to connect with others on. I also wanted to have you start thinking about your community, however that looks to you. And I'd really like to talk through some ideas and terms to consider this as a beginning of looking at cultural humility. I encourage you to be a lifelong learner in this arena. And when I think about community, I start thinking about my family, my immediate family, but then I think bigger than that. I think about my city that I live in, Bellingham. I think about the county, Whatcom County. I think about that being in Washington, and Washington being part of the Pacific Northwest, and all the way out to the world. And so it's interesting to think about. I think communities change for you in your lives. And it's something just to be aware of so that you can have conversations easily with others and get to know them. So cultural humility, I like this phrase a lot. It's the ability to be open to others in relation to aspects of their cultural identity. So I invite all of us with gentle curiosity to learn about other people's cultures. And I think that this is going to play in so well with us providing quality care for everyone. And speaking of quality care, we're talking about populations that are different possibly from our population or from our cultures. And so we want to make sure that we're providing that culturally sensitive care. So it's important that we have healthcare professionals that are really looking at providing assessment and intervention that acknowledges, respects, and integrates those patients and their families' cultural values, beliefs, and practices. So that's our work. That's our work to get comfortable with. And as I think about that, we look at a little bit more in detail, what does that mean? In conversation, for instance, I think these three key factors. We listen for understanding when we're having conversations with our clients. And we want to make sure that we ask questions that allow them to share. So what is worrying you the most might be a question that you use. And this is a bit scripted, and I want you to think about that because it's a nice way to practice, but then I really want you to be able to make it your own. And so when we think about being open, we want to find out what more can we do for you. So we might ask a question like, are you open to referrals and resources, not just assuming that they are? And of course, respect is really important. We want to make sure that we are respecting their communication practices, every client's communication practices. And so we might say something like, what information should be shared with whom in your family? So just ideas to think about as you go forward, providing culturally sensitive care. And I wanted to take a minute to look at, now this is the Whatcom County Community Health Needs Assessment that I'm going to show you data from, but I want to explain that this Community Health Needs Assessment, the CHNA, is required by the Affordable Care Act, and it's required to be done every 3 years. We collaborate with our health department and our community here, and we focus in on disparities so that we can create an improvement plan for our community. And I want you to think about this and look at it from every community that you are involved in. It should be there, it should be available for you. So this is our most current Community Health Needs Assessment. And what we did with it, with all the data that was collected, we put it into 4 frameworks, pillars as we call them, and you'll notice under the equity on the right-hand side, cultural humility came up, and also assistance for people who are homeless. So I'm going to talk about some specifics there. In our community, we've discovered that the highest levels of health disparities are experienced in these members in our community: the Alaskan Native, American Indian, the Latino, Hispanic, and people who are experiencing homelessness. So I want to think about those community members particularly that are at risk for health disparities. And they feel like they're treated insignificantly and that they're made to be invisible. And that's a really hard place to come from when we are navigating them through care or providing the care. There's an experience of inequalities in the distribution of our resources. And I love this idea of equity means that we give everyone a shoe that fits, versus equality, which means we give everyone a shoe. So we're really paying attention to those cultural beliefs and values and working in that with them. So when we look at tips for providing culturally humble care, we have had a lot of conversations and done a lot of research with these 3 members of our population, of our community. But I also want to caveat, I want to warn with this, that just because one of our clients identifies as an American Indian or Alaska Native, doesn't mean that they necessarily buy into all this about their culture. So we need to keep that in mind too, never assume. But when we did interview and talk with some people who identify as American Indian or Alaska Native, their recommendations were that we talk softly and that we limit the amount of direct eye contact that we have. We honor their personal space. And we think about their style in communication that they often want to process when we are talking or asking a question. So giving them that pause, giving them that silence where they can actually process and then be able to respond. And certainly looking for nonverbal cues of discomfort or confusion to make sure that our clients are understanding what we're saying and we're understanding what they're saying. And we never want to assume anything, so we'll ask about their cultural practices and their family involvement. What's important in that for you? We want to make sure that we get to know these people. So I wanted to talk about people who are experiencing homelessness too. That's a very different culture, and it's interesting for me to think about because it's a hard culture for me to actually, I don't know, connect easily with. But if I think about and the talks that we've had and the research that we've done, we know it's a nomadic culture. We know that they're every day struggling with basic needs, with where am I going to sleep, how am I going to take care of my children. So it's interesting to think about if I were actually helping a client navigate that was experiencing homelessness, to step back and to think about where they're coming from and what's on their mind that might be a barrier to me being able to help navigate further. And maybe we need to have conversations about that prior to us moving forward. So just some things to think about. We have a lot to learn. I'm thinking this is a great area for us to spend our time. So when we think about providing culturally humble care, Maslow's hierarchy comes to mind for me, because that's that theory of Maslow's that says if at the foundation you don't get your basic needs met, you don't feel safe, you're not going to be able to move forward in scheduling, making an appointment, caring for your teeth, etc. So that's a really important factor to keep in mind as you're talking with these clients. So you have to listen. You have to hear where they are and what's hard for them, and then help integrate multiple types of care, whatever it is that that client needs. Let's integrate more people, more services for them. So then I wanted to talk a little bit about our Latino Hispanic population. Common cultural characteristics here in the United States for this population, these members, is family, respect, and personalism. So if a client identifies as Latino, this is a conversation that we would want to create. We would want to have a conversation about who is your family, you know, what personally are you connected to? And as we have that conversation, we're building that trust with that client or those clients. And then we can go forward and have other conversations about navigating care. So other tips that come to mind when we work with these members of our community is that they often, or at least sometimes, will come with groups of people, not just one person. So you may be talking to a family, for instance. So things to keep in mind. And one of the things that we learned is not just because a client identifies as a Latino or Hispanic doesn't mean that they speak Spanish. And maybe not English either. They may have an indigenous language that they speak. So it's really important for us to know what language are you really comfortable speaking in, and then having an interpreter there. And some of the indigenous languages may get challenging for us to have interpreters, but we may have maybe a child that speaks both English and the indigenous language, and we can get to know the family through them, but certainly we wouldn't want to depend on them for a medical consultant or a medical interpreter. So again, lots of things to think about. And I think that when I think about health disparities and choosing professionals with these members, I want to make sure that we, number one, know the client's language, but we also want a provider that's culturally competent and not discriminating, and preferably a member of their culture, which is challenging and difficult, but if we have that, that would be ideal. So again, just tips for thinking about providing navigation of care for Latinos. So when I look at practical application of cultural humility, this is what stands out for me. What is their family? What does that mean to them? What about communication? What language do they speak? And also, us not being condescending, speaking loudly or slowly, thinking that that's helpful. And certainly paying attention to respect and what that respect looks like in other people's cultures. And I think for me, if I'm aware and I watch how people are responding, I can pick up a lot just in that nonverbal. So honoring that, and maybe even asking a question about it if I'm not sure. And then I think about health literacy. And again, we want to ask questions and give simple descriptions so that people know what we're actually saying. And I want to really think about the clients need to be a part of the decision making in the treatment. So we need to make them feel like they are a part of it, because health outcomes are better in that case. So when I think about navigation opportunities for all of you, certainly I encourage you to keep learning about cultural humility. I think having conversations and reading, and you can just learn so much more. It's a lifelong quest and journey. And using appropriately culturally receptive questions to learn more about your clients and to earn that trust. And then certainly, with that understanding, you'll have an impact on their experience. And then referring to a culturally appropriate dentist or doctor, and offering educational resources in their language is really important as well. And there are a lot of resources that are printed in multiple languages. So as we look at oral health resources here in Whatcom County, we have the Lummi Tribal and the Nooksack Tribal dental clinics for our Native American population. We have a one-day-a-year Whatcom County Project Homeless Connect, and that is a day-long service, multiple services, and one of them is Unity Northwest opens up their dental clinic for the entire day and does treatment for people who are experiencing homelessness. So it can almost work as a dental home other than emergencies. And then we have Seymour Community Health Center, Unity Care I mentioned. We have Smiles for Life, which is for seniors. And we have the Bellingham Technical College that has a dental assistant and dental hygiene clinic. And then we have Whatcom Alliance for Healthcare Advancement here. We call it WAHA. And that's a place that you as navigators can go when you have a client that is not getting connected to the services that they need. And they are really helpful. As I look statewide, there are a lot of resources as well. We have 2 nonprofit dental clinics. In Federal Way and Vancouver, we have those Smiles for Life programs throughout the state. We have multiple college dental programs that offer services for clients as well. And one of the recommendations I would make is when you are referring a client to a facility, either make the call yourself or know what the particulars are. Because sometimes, for instance, at CMAR, if it's an emergency, they open their doors at 8, but you need to line up at 7 to be sure that you are seen that day. So nice to help navigate in those ways and decrease barriers. So other state resources are donated dental care programs and other community health centers throughout the state. And then there's the Family Health Hotline, which is sponsored by an organization called Within Reach. And I would say if you're really stuck and you haven't been able to find a resource referral, I would call this number and have them help you. So thank you for being here and learning more about providing culturally appropriate navigation of care to your clients. And thanks for being an oral health champion.